Hi everyone, and welcome to A&P with Dr. O. Here we are going to take a look at a few additional muscles of the neck, but we're going to focus a lot on the trunk. And we're going to be using images of the large muscle model from lab. The images will be a little bit easier for us to label. But of course, when we get to lab, we'll get to work with the actual model. We'll go ahead and start with this image of the large muscle model. And what we're looking at here is we're looking at superficial muscles on the left side of the model. And then on the right side of the model, those superficial muscles have been removed, and that way we can see the deeper muscles. We'll start with the pectoralis muscle, and we have a major and minor. This is the pectoralis major, and that is going to allow us to adduct or flex the humerus. Think throwing a ball underhand. And then on this side, deep to the major and smaller, that's why we call it minor, is the pectoralis minor. And the pectoralis minor allows us to depress and protract the shoulder. We can see several of our abdominal muscles. This is our rectus abdominis. Rectus means straight. That means that the fascicles of the muscle are in a straight alignment. We also sometimes refer to this as the six-pack. If you've ever heard that terminology before, we're referring to the rectus abdominis. And the rectus abdominis is going to allow us to flex the vertebral column. Think about the action that you would do to perform crunches. That would be flexing the vertebral column. We have this abdominal muscle where the arrangement is at an angle. We know that when something's at an angle, we use the term oblique, and this is the superficial muscle that is at an angle and therefore is the external oblique. And this allows for rotation of the trunk, compressing the abdomen, think sucking in your stomach. Those are some examples of actions of that muscle. And then over here, a deeper abdominal muscle, these fascicles are horizontal, and therefore we use the term transverse. This then would be the transverse abdominis, and that also is going to compress the abdomen. Over here, we can see the neck blown up a little bit more on our large muscle model. And what I would like to point out are these muscles here. These are known as the scalenes. And they are going to be important for inhalation. They elevate the upper ribs, and that's why they're useful for inhalation, because of that elevating of those upper ribs. And then we also have this muscle right here, and that muscle is known as the levator scapulae. And when I see levator, I think of the term elevator, and that's a good association because the name of this muscle tells you what it does. It elevates the scapula, and that's why we call it the levator scapulae. Let's continue with the next slide here. And this is going to show us some additional additional views of that large muscle model. If we turn the muscle model to the side and again are looking at the deeper muscles, we can see these muscles here that almost look like serrations or teeth. And those are known as the serratus anterior. They get their name because they look serrated. Think of a serrated knife, like a steak knife or a bread knife with the little teeth on it. That's the association I like to use for the serratus anterior. This muscle moves the scapula, think punching or pushing. It also elevates the ribs and protracts the shoulder. Then we have this muscle here that is between the ribs. We call that the external intercostal. Inter means between, and costal, think of the ribs. That's our external intercostal right there. Then we're looking at that same model in an anterior view, but we've removed the portion of the trunk that we focused on a moment ago. So we've removed the pectoralis muscles, those abdominal muscles that we were looking at, and we removed that in order for us to see this large muscle here just under the thoracic cavity, and that muscle is going to be the diaphragm. And the diaphragm expands the thoracic cavity, extremely important muscle for inhalation and for breathing because it's going to be expanding that thoracic cavity for us. This is the portion of the trunk that I removed so that we could see the diaphragm, and I've turned it over to the posterior side because that's where it shows the internal oblique. There's that internal oblique. It is going to also rotate the trunk, compress the abdomen, and then flex or bend the spine.